welcome to the Graduate Institute podcast, in which we will talk about current issues impacting economics, politics, health, and society. We are your hosts. I'm Ellie,
Carina, and Panis.
Today's episode is going to focus in on digital health technologies and the present and future impacts of AI on international relations. Today, our guest is Dr. Mehdi Snen, who is the CEO of the International Digital Health and AI Research Collaborative, also known as IDARE. And IDARE's strategy is to develop an end-to-end approach combining research, infrastructure, capacity development, and governance to shape the digital health research and innovation space. And it addresses data and AI challenges that no single country or research institution can solve on their own. Mehdi is a digital health researcher with a rich clinical neuroscience and data science expertise. Thank you so much for joining us today, and we are thrilled to have this discussion with you about evolving AI technologies and how they're influencing the health sector. So to start off, we would love to know a little bit more about your background and what led you to IDARE and your interest in AI and digital health.
Thank you for this invitation, and I'm very happy to join you for this podcast. So currently I'm, as you said, the CEO of the International Digital and AI Research Collaborative. Previously, I was the technical leader of the Human Brain Project at the EPFL, which is a €1 billion project about brain simulation platforms at the European level and development of new infrastructures for new kind of computing like the neuromorphic computing. And before that, I was at the University of Geneva. I've been working on clinical trials at the Hospital of Geneva on the palliative care, specifically for quality of end of life, brain health, and most of my activities is linked to neurodegenerative disease, mental well-being, health, and machine learning. Recently, I've started working on the aging process, a little bit on longevity. My initial background, surprisingly, is from finance. So I was in the banking industry, and then I've decided at some point, for good reasons, to get back to the university for further research and studies. And then from that point, I've started working in health and digital health specifically.
Amazing. Thank you so much. Before we get into some of the things that you were talking about, like brain health, how have you seen the health sector and healthcare change with the increasing digital innovation and AI in recent years?
So there is no change on the same speed in different specialties. So if we pick the AI, we may see that most of the AI applications are being developed in radiology. With an extensive use in clinical settings of the AI. If we look at different other speciality, we will rarely find a lot of use of AI in that space. So it's not well coordinated for good reasons. The reason is how many data do we have and how easy is accessible this data, especially when it comes to the patients. So the electronic health records are not very wide used devices or assets today in medical settings, but given the way we collect the radiography and data and images, medical images, which are most of the time digitalized, it's very easy to reuse this data for secondary use other than the diagnosis to bring it to the AI training process, and that's give a little bit of change. The change is happening a little bit in the healthcare, but often the disruption is not happening. So there is no disruptive change till now within the healthcare space, simply because most of the disruptive innovation that we have seen comes together with a new way of practicing. There is always the iPhone and applications. That changes completely the way we interact with mobile phones. The iPod and the interactions, the mobile phone itself and our way of interactions. So that's a disruption. There is no such kind of disruption. It's a very classical environment, very well guarded because of the sensitivity of the data and also because of the expected output on the patient health. But there is a very old proverb saying that electricity is not a result of a continuous evolution or innovation in kernel. Electricity is very disruptive regarding to the kernel. And I think or suspect that in the healthcare, we will be waiting for a very disruptive innovation that will bring the AI closely and more inside of the entire specialties of healthcare.
With the data sensitivity that you just touched on really briefly, how do you see the implications of that in data collection and patient anonymity, and if there's any hacks to the system or anything like that? How could these technologies, are they addressing those data breaches perhaps, or is that something that's being regulated enough?
So if we adopt the technology, we have to adopt the risks that are coming with the technology. There is no escape from that. So data could be very well protected at a very high levels of protection at military grade or wherever else, but doesn't mean that the data will not be leaked out. There is always a risk, and we need to deal with that risk in our perception and in our daily usage of this data. Several domains related to the healthcare. Let's talk about a little bit neuroscience and brain health. We have developed the very advanced tools to extract brain signals, and these fMRI, the electroencephalogram, EEG tools that collect all of the data about the brain. And 10 years ago, we have considered that these tools are safe and secure to the data collection, since rarely we see the patient data linked to the EEG or to the fMRI, maybe a little bit more for the fMRI than the EEG. Recently, so how the technology evolved, we've been talking about Neuralink coming from Elon Musk. Neuralink, they are today able to take these sensors, take these signals, and make the translation from signals to some visual output. So if you are looking at a specific location or specific color, then we can extract that directly from your signal. So we can pick back all these signals, and then we can start making the translation to understand at that time we collected these signals, where was the patient or the people who got these signal processing. So regarding the evolution of the technology, what we consider today safe may be unsafe in the upcoming years. And that's the most risky part, is to be a little bit visionary when we start collecting the data, regardless the way we are protecting it, because even these protections may be unsafe in the upcoming years, especially with the quantum computing hitting us quickly.
Really interesting that you bring that up, and I actually had a question about a phrase that you said when we talked on the phone the other day, that nature hates empty spaces. I'm wondering if you could talk about that in relation to the risks with this evolving technology and kind of what you meant by that.
So there is a risk from the data leaks, the risk of security, privacy, ethical issues. There's a lot of risks there about how are we going to use the data or the results of data analytics. We need to remember, AI is a tool. It depends on in which hands we put this tool. So if you give it to someone who would like to save the humanity, that will help them to save the humanity. But if you give it to someone who would like to distract the humanity, that's also another purpose. So it's the tool. We should not be afraid from AI. We should more be afraid from human being, to be frank. So that's how it works. It's the same thing than any other kind of technology innovation. Cars, mobile phones, meaning at the early beginning, when we remember about Nobel discovered the dynamite not to build bombs, but it's much more to help extraction. So that's the way we use the technology that will impact us. Now, nature hates the empty places. What does it mean? For me, it's if we build all these tools and we do not cover different spaces with specific rules, regulations, governance, ethical principles, and we do not put safeguarding around these empty spaces, for example, how the patient will interact directly with the AI. For the moment, we are really talking about the final interactions. We are much more talking about the early interactions with the bias in data input and how the practitioners are looking into the AI. But what's about the patient and AI? If we pick the mental health, if we pick the neurodegenerative disease, and we build some AI companion, for example, for the isolated people suffering from neurodegenerative disease, are we going to make these people dependent on the AI? That's the worst part of it. So if there's an empty space there because they are isolated, because they need a companion, and then we equip them with a virtual, well-done, human-like companion based on AI. In this case, the one behind this AI, isn't it the one who can master the process of healthcare firstly, but also the hack of the brain, the hack of the behavior, the change of the behavior of these people who got used to this companion. And this is the point that we are really talking about, simply because when we talk about AI for healthcare, we bring it at the level of healthcare providers, how doctors will use it, how nurses will use it, how researchers will use it, how hospitals will use it, but we never talk about the patient usage of AI in healthcare.
That's a really good point. I think we often hear with these technologies that it's going to replace nurses, it's going to replace doctors, but like you said, not only is the patient aspect not being considered, but we are missing that human perception. Like you were saying, those things cannot really be replaced or replicated, at least with the technology where it's at now. You were talking about having safeguards in place. With the recent news with Microsoft and Twitter and the firing of ethics teams and departments, how critical is this, in terms of the safeguardings that you're mentioning, having these ethical departments to ensure that there is responsible and ethical AI when developing and implementing these technologies into society. Like you said, especially if someone becomes dependent on these tools, I would assume these ethical questions are really important to consider when developing them.
It's very important that if we are talking about commercial entity building their own responsible AI or responsible behind of AI or beside of AI, anything, then there is the major driver of their regulation will be return on investment rather than anything else. So that's because of the entity is a commercial entity, is there for profit, is not there for building responsible AI or limit the scope of actions where they can deploy the AI. So we should not expect that they will regulate it according to what we are expecting, but much more about they will regulate it regarding with regards to their stakeholders' expectation rather than common public. So that's a fact. And it's valid for the green transition, it's valid for climate change, it's valid for youth protection, and we can see about youth protection and Meta Group about there is no restrictions a little bit on the age, for example, access. It's valid for all of these big technology players. So this is being said now, what does it mean, responsible AI? I frankly have doubts on being able to define a responsible AI simply because what we've early said, AI is a tool. So it's not a responsible AI, it's a responsible human behind the AI rather than responsible AI. And then we have this always this kind of way of escaping our issues, putting the issue on something else other than us. It's about us, it's about the human being. So rather than talking about responsible AI, which is a direct result of the man behind the AI, we should talk about irresponsible AI. So what is an irresponsible AI? It's and how can we define it? And if we can define this irresponsibility in AI, then we can define how roles should be assigned into that space. Now, we are working, for example, on responsible AI projects for healthcare with IDRC and with a couple of our partners in Africa, Latin America, and Southeast Asia. And the major issue is what we define today as a responsible AI. Again, all the measures, there are 100 ways and gaps that will help researchers to escape from this responsibility and the way of building this responsible AI. I'll give you an example. Years ago, European Commission decided that they need to regulate the AI research in the brain health, but also in overall AI research in clinical settings. And then they come up with a regulation that was a top-down approach. So a couple of policymakers decided that this is the way we will be using AI in the research space. What happens is that 6 months later, we come up with the synthetic data concept. So they said you cannot use the data from patients in this case, and this case, and this case. And we found that this will limit the space of research that we have. So the synthetic data is another area that we are creating data that are similar to the data coming from the patient, but they are not real word data. So they are synthetic data. And then with that, we do not have any kind of violation of the regulation. So we end up by being able to produce the same quality of research, but also the same scope of research, by bypassing these rules very easily. So unless the regulation and responsible AI is being done in a bottom-up approach, so that researchers and people who are dealing with the AI, the human behind the AI, are sitting together, building together this vision of what is the regulation of AI, that we will always find a way to bypass the regulations and rules that are being brought to us by the policymakers. And that's exactly the same thing then when we talk about cybersecurity. Whenever you bring new measurement things where a regulation is absolutely invalid when it comes to the cybersecurity, meaning there is no reasons that we can suspect that we will respect these regulations in cybersecurity, and the same reasons let me think that there is no reasons that we suspect that we will respect the regulations in AI.
We talked about the application of AI mostly in radiology, but according to your opinion, what are the most promising applications of AI in healthcare in the next 5 to 10 years?
Today, there is a lot of machine learning and AI invested in neuroscience and brain health. Firstly, to understand the brain mechanism and brain health, because it's still a very mysterious box for us. But secondly, also because that's a key for different other things, and the data is available, tons of data when it comes to the brain. So wherever we have tons of data, there will be a big investment in AI because we can train these models. So I think brain health, and surprisingly not directly in the healthcare, but in pharmaceutical science. In pharmaceutical science, we already heard about AI for drug discovery, AI being used for the vaccine during the COVID, and AI for genomic sequencing for a lot of things. I think in pharmaceutical science, which is a strong part of the healthcare process, there will be a lot more investment because of the needs for new drugs, the appearance of new viruses and diseases and conditions, and because of the investment, a lot of investment, and the data is there. That's the major point. Now, when it comes to the direct healthcare, depending on how we will approach the AI, we have seen that there is, if you consider the AI as the core therapeutics, so like a digital therapeutics, you have a companion that will help you get out from the depression or anorexia or whatever else mental conditions. Then in the process of clinical validation, the process of evidence-based extraction, how to validate these applications is long, tough, hard, and very costly, and measure technical enterprise or startups do not master this process. So that will limit the investment in that space. So recently, Germany decided that these digital therapeutics could be prescribed. So we have this kind of application prescription in mental health conditions, but till today, there is no evidence of the efficiency. And that's something that we miss, and something that we need to put in the center, in the middle. I think evidence-based AI should be the early thought when it comes to the healthcare, how to bring, and then since we are running too fast towards results, we have less evidence-based decision-making, but we have much more experiment-based AI rather than evidence-based AI.
I'd like to talk a little bit more about gender bias, and I was listening to a podcast where some argue that AI and machine learning can minimize or reduce bias, but then I kind of go back to some of the documentaries like Coded Bias, where the the AI tools that they were using, it did have bias in there, and when it came to people of color and facial recognition. But on the other hand, I think some do argue that in healthcare setting, it does minimize that. So what are your thoughts about bias?
When it comes to gender, this is very controversial, so I have to be very careful. First of all, some of the facts that are in data will be reproduced by the AI. So these are facts. Either we assume that for example, the salary gap in the gender in Switzerland is a fact. So if we bring in AI, we give all the data about salaries in Switzerland to the AI and say, oh, I have a candidate, a male and a female, give me a price, give me a salary. Then the salary will be in the image of the data that we've collected. But we already have the bias inside of the data. So men will receive higher salary than the female candidates. That's something that we need to accept. If the data is biased, the AI is biased. So you cannot change and build a better world if your real world data is already biased. That's the point. Now, there are a couple of other facts where men, for example, commit more suicide than female, or men are more criminal than female. Okay, that's not a gender bias. That's a fact too. So if we do about prediction of being in jail or making an infraction, then male will be more represented than women. That's another issue. So we accept fact, because this is how it works, this is the human being, and we accept the bias that we have in our real world data, then the results will be acceptable. But if we do not accept, and we need to correct that, then we need to act on our own data firstly. We cannot act on the model of the AI saying, oh, correct this bias. That's not how it works. That's absolutely not how it works. So as long as we do not change this way of doing things, the way of producing data, we will keep this bias inside of the data. AI will not resolve these issues. We need to resolve these issues of good governance. And second point, now in healthcare, most of the researchers in AI in healthcare are male. So when I think about any kind of issue or problem that I would like to resolve, pain, for example, neurodegenerative disease, I think that in my clinical trial I got like 20 male and 2 females, to be frank. So we need to bring more females and more gender diversity in the principal investigators' roles in the AI. That's, unless we open that, to open the AI research in healthcare for more problems, diverse problems, gender diverse problems, who will stay on the male vision of the AI. And that's a big problem. And same thing, it's white men vision of AI. And then we bring these solutions of white men vision to AI and we try to make it replicable in the global south. There is no chance that this will be acceptable, because what our issue or what are our problems in the global north is absolutely not the problems of the global south. So there is a bias there too. So we need to open the AI to a little bit wider population in the global south. And that's what we do at ADER. We try to